Our next speaker is Sonia Shah. Sonia is a prize-winning science writer and investigative journalist who's written critically acclaimed books on malaria, human rights, the drug industry, and international politics. Her fourth and most recent book is Pandemic, Tracking Contagions from Cholera to Ebola and Beyond. It was selected as a New York Times Book Review Editor's Choice. A recent article in the New York Review of Books described Shah's book as, quote, required reading for anyone working in global health. So with that, Sonia, please take the stage.
So in 1962, Sir Macfarlane Burnet, the virologist, said that to write about infectious diseases was as if to write about something that had passed into history. Then over the following 50 years, over 300 infectious pathogens either newly emerged or reemerged into new places where they'd never been seen before. So Zika is just really the latest one. We've had Ebola in West Africa, where it had never been seen before, new kinds of avian influenza, including one that struck the United States, caused the biggest outbreak of animal disease in US history last year, new kinds of coronaviruses like SARS and MERS, tick-borne illnesses, antibiotic-resistant bacterial pathogens, and the list goes on and on. So as a writer interested in social change, and as a science journalist, this really interested me. So I spent the last 6 years trying to figure out how it is that microbes turn into these pandemic-causing pathogens. And I did that through a number of different ways. I looked at the history of pandemics. This is cholera in 1832 in New York City from a data visualization we did with Pulitzer Center on Crisis Reporting. So I looked at the history of pandemics, and I focused particularly on cholera because it's one of our most successful pandemic-causing pathogens. It's caused 7 pandemics in its history, and it's extremely deadly. It kills about half the people who get it if they're not promptly treated. And it's going on right now, just a few hundred miles off the coast of Florida and Haiti, which is pictured here. Then I also went to places where new pathogens are emerging to try to figure out what are the political and social drivers that push these microbes into human populations. And I found that certainly the major source is, of course, wildlife. About 60% of the new pathogens that are emerging today come out of animals. Over 70% of those come out of wild animals. So from bats, we've gotten Ebola and Nipah and SARS and Marburg. From birds, we've gotten avian influenza and West Nile virus. From rodents, we're getting monkeypox and Lyme disease. For monkeys, of course, we've got malaria and HIV, also probably Zika. And I think it's because as our human populations are expanding so much, we're destroying a lot of wildlife habitat. And of course, that means we lose a lot of species, wild species. But it also means that the ones that remain have to crowd in ever closer with human habitations. So we're creating more and more of these interfaces between humans and wildlife. And that allows for novel, intimate kinds of contact in which the microbes that live in their bodies can spill over into our bodies. But of course, just because these pathogens are emerging in people doesn't mean they're going to cause epidemics and pandemics. I mean, microbes, when you think about it, they're these microscopic little things with no independent locomotion whatsoever. To spread, we have to provide those opportunities. It's human behaviors, of course. So we're providing those in a huge amount through our cities. So the process of urbanization that first started in the 19th century, which cholera took advantage of, is really reaching its peak now. So by 2030, the majority of people will live in cities. And they're not going to be cities like Washington, D.C. and London. They're going to be cities more like Monrovia and Freetown in West Africa, where there's a lot of ad hoc development, a lot of lack of infrastructure, and a lot of slums. About 2 billion of us will be living in slums by 2030. And we see some of these new pathogens are already starting to exploit these opportunities. Ebola is a great example where we've had Ebola outbreaks since at least the 1970s, but they were small and self-limited because Ebola had never really reached any place that had more than a few 100,000 inhabitants. Well, at the end of 2013, when Ebola broke out in West Africa, within a few weeks, it reached 3 capital cities with a combined population of nearly 3 million. And that's an important reason why it became such a huge conflagration, bigger than all the previous Ebola epidemics combined. Zika arguably is also taking advantage of the rapid urban expansion in the tropical Americas. We've had Zika since at least the 1940s, but it was in equatorial Africa and Asia, carried by a forest mosquito, didn't really bite people that much. Well, now it's in Brazil and elsewhere in the Americas where there's been giant expansion of cities, and with it, the mosquitoes that bite humans and only humans, and that's a huge reason why it's been amplified the way it has. But it's not just people that are crowding together so much these days, it's also our animals. We have more animals under domestication today than in the last 10,000 years of domestication until 1960 combined. So it's a huge number of animals we're keeping now to satisfy our demand for meat. And an increasing proportion of these animals live in really what you'd call the animal equivalent of a slum. That is factory farms, where you have hundreds of thousands, if not millions, of individuals crowded really closely together, where they're breathing on each other, they're touching each other, they're being exposed to each other's waste. And this is another opportunity that these new pathogens are exploiting. Avian influenza is a perfect example of that, where avian influenza normally lives in wild waterfowl, doesn't really cause a lot of disease in those birds. But because we're building these factory farms under the migratory pathways of these birds, particularly in Asia, those viruses get to drop down into these giant places full of captive birds. And that means they get to replicate and amplify and mutate, and they become more virulent. So we've had an increasing frequency of these new kinds of more virulent forms of avian influenza as a result. Now, crowding, of course, leads to a secondary effect, which is sanitary crises. We still have our old sanitary crisis from the 19th century and beyond. About 2.6 billion people around the world don't have access to any modern sanitation, which is really a standing catastrophe that pathogens have been long taking advantage of. But we also have a new kind of sanitary crisis with our livestock waste. Around the world, our livestock produce 7 billion tons of excreta every year. And that's far more than croplands can possibly absorb, which is how we generally try to use these wastes and have in the past. So what we have now is a lot of these manure lagoons. These are essentially giant open cesspools of animal waste, untreated. And so when it rains or when there's storms, all this material gets to get into the environment. And because so many people are exposed to this waste material now, pathogens are taking advantage of this too. Shiga toxin-producing E. coli is just one example. This is a pathogen that lives in about 1/2 of all cattle on American feedlots. Doesn't really cause them any problems. But because their cattle waste is getting into our food and water so often, 70,000 Americans are getting sick with Shiga toxin-producing E. coli every year. And then, of course, we're spreading this stuff around in the most efficient way possible with our flight network. Cholera took advantage of canals and steam engines, but today we have something even better, which is not just a few capital cities with flights between them, but airports in every small city and town, tens of thousands, if not hundreds of thousands of connections between them. So even when one of these pathogens emerges in a place where there's not a lot of susceptible populations, it can quickly travel to a place where there are susceptible populations, to such an extent, actually, that you can now predict where a pathogen will strike next simply by measuring the number of direct flights between infected and uninfected cities. So this map shows the same simulated flu pandemic that I showed you on the previous map. But this map is all the cities as connected by direct flights. And you can see on a map like this, a flu pandemic resolves into this sort of perfect series of waves. So these are some of the factors I looked at to try to understand how microbes become pandemic-causing pathogens. But it's really only half the story, because of course we don't take this stuff lying down. We fight back. We have political defenses, medical defenses, social defenses. And so the other half of the story that I looked at is, what are our constraints on meeting those challenges? So how are these pathogens able to get through our defenses? And I think one of the most important challenges is certainly the rise of private interests. of the 100 biggest economies in the world today, only 49 are governments. 51 are corporations. So that means we have private interests that are far more powerful than some of even our governments and our public agencies. And you can see how that can allow pathogens to spread. One example is with the World Health Organization, our premier public health institution, which now controls only 25% of its own budget. 75% is controlled by donors. And that has a real effect on how pathogens can spread. And the Ebola epidemic is just the most recent example. When the WHO delayed calling a public health emergency of international concern and mobilizing the international community by weeks and even months. And there's a number of reasons why. But we know one reason, according to leaked emails that were acquired by the Associated Press, is that they didn't want to frighten investors. But this isn't happening just in faraway places with weak states. This is happening right here in the United States as well. You look at antibiotic-resistant bacteria, for example. Of course, we've all known since at least the 1940s that if you use antibiotics in a way that's not medically necessary, you will trigger the evolution of antibiotic-resistant pathogens. Well, here in the United States today, 80% of the antibiotics we consume are used for commercial reasons. They're used by farmers in their livestock to enhance growth, to fatten their animals for market faster. And public health agencies like the FDA and others have tried to control this practice since at least the 1970s, and they've been stymied every step of the way by the farm lobby. As a result, we have 23,000 Americans dying of antibiotic-resistant pathogens every year. Now, medicine has come a long way since the time of cholera in the 19th century when doctors thought that cholera was spread by miasmas, these smelly airs, and wouldn't recognize that it was actually in the water. But at the same time, I do think that there is a mismatch. So we see a lot of these pathogens right now are coming out of animals. They're being driven through human populations through social and political factors. So you would think that the best way to kind of tackle this problem was through an interdisciplinary approach. You get the veterinarians and the wildlife biologists and the ecologists and the engineers and the anthropologists and the political scientists and the economists and the biomedical specialists all together to look at the entire process. But of course, that's not what we do. We approach infectious outbreaks as solely a biomedical phenomenon. And that is to reduce it to its smallest components and then strike at them with sort of surgical precision. And we do this in a very militaristic way that I kind of call microbial xenophobia. We kind of act like each of these new disease outbreaks is an invasion of this foreign germ that we have to, kill, take out our drones, for example, to coat Florida with killing chemicals when dengue broke out in 2009. Now, dengue, of course, hadn't been in Florida for 70 years. It was an unprecedented outbreak. And it was immediately attacked as this, assault. And we attacked it with our best sort of killing chemicals. In fact, there wasn't any invasion as such. If you look at where Florida is, it's surrounded by countries where dengue is endemic. It's a permanent part of the landscape. And the mosquitoes that carry dengue have been present in Florida for a long time, too. So there hadn't actually been any invasion as such. What had happened is in 2008, we had the foreclosure crisis. And that meant a lot of abandoned homes. And because this is Florida, we're talking about, that meant a lot of empty swimming pools. And so when the rains came, all these empty swimming pools filled up with standing water. And a year later, lo and behold, we had this unprecedented outbreak of dengue in Florida. Now, would have addressing the housing crisis have helped contain or even prevent the outbreak of dengue in Florida? I have no idea because nobody tried that. What we do know is, arguably, the biomedical approach has failed in the sense that dengue is now considered a permanent part of the landscape of Florida. It's endemic disease there. Now, as we've had this emergence of all these new pathogens, it's been accompanied by a rise in xenophobia. So just as we have microbial xenophobia, we now have a rise in actual xenophobia and scapegoating of marginalized populations. And this was characteristics of the earliest pandemics in the 19th century and before that, for sure. 19th century cholera was blamed on the Irish immigrants, and then it was blamed on the Muslims, and then it was blamed on the Eastern Europeans. And today we have Donald Trump blaming Zika on Mexican immigrants, and all the borders closing in Europe for fear of disease carried by Syrian refugees. And not only is this a violation of people's human rights, it also allows pathogens to spread basically unimpeded, because then we fail to address the underlying conditions that allow them to do that. So a few years ago, the epidemiologist Larry Brilliant predicted that a pandemic that would sicken 1 billion people, kill 165 million, and cost the global economy $3 trillion would occur sometime in the next 2 generations. So that's a pretty scary thought. But at the same time, he didn't have a crystal ball. He's not Nostradamus. This is actually a warning of what will happen if we don't change. And I think there's a lot we can do with early detection to begin with. We don't know which microbe is going to emerge to become the next pandemic-causing pathogen. But we do know how it happens, which means we can predict where it's most likely to happen. So this map shows hotspots, places where there's a lot of intensification of agriculture, a lot of slums, a lot of invasion of wildlife habitat, a lot of flight connections, or some combination of all of those things where new pathogens are most likely to emerge. So while we can't look for microbes everywhere, we can't do active surveillance of microbes everywhere, we can do it in those hotspots, and that's happening already in an ad hoc way to see where are microbes actually changing and maybe adapting to humans, and to control them right at the source before they start epidemics. But I think ultimately the goal has to be to prevent outbreaks altogether by reducing the conditions that allow them to occur. So doing things like restoring wild habitats so that the microbes that live in animals stay in animals and don't cross over into people's bodies. We can do things like protect the health of the most vulnerable among us, people who live in slums, animals in factory farms. But ultimately, I think what this all really leads to is what we need to do is really reimagine our relationship to the microbial world. And there is no us and them anymore. There's no them, the microbes. This is their planet, really. They were here first. And they're kind of a lot better at living on this planet than we are. And I think really what that means is we have to recognize that our health is connected to the health of our societies, certainly, but also the health of our animals, our wildlife, our livestock, and also our ecosystems generally. So I don't think we can live in a world like McFarland Burnett predicted, where infectious disease is a thing of history. Infectious disease will always be part of our future. I think that's part of the human condition, is we live in a microbial world. We'll always have infection with us to some extent. But that's a risk we can learn to live with, I think. And there's so many ways in which we can reduce the risk of highly disruptive and deadly epidemics and pandemics. And the real trick, I think, will be finding the political will to do that. Thank you so much for listening.
Well, that was terrifying. Thank you very much. One thing before we even get any further, I noticed in your list of hot spots, you seem to have the eastern seaboard of the United States as one of them. Is that because of the flights, or?
I think it's a combination of flights and livestock. And yeah, I mean, we've had a lot of emergence of new diseases here too, Lyme disease being just one of them.
You've written that experts predict a major pandemic, as we just showed, within the next couple of generations. I realize that you're not Nostradamus either, but do you have any feel for what it might look like?
Yeah, I do. Well, we're living through 3 pandemics right now, right? We have the HIV pandemic that's been going on since the 80s. We have the cholera pandemic, the 7th cholera pandemic is going on right now. And now we have a Zika pandemic. I mean, if you define a pandemic as an outbreak of disease that starts in one part of the world and spreads like a wave, a single wave across global populations and continents, Zika is certainly fits that definition. So we do know what it looks like because we're living through several right now.
I think the pandemic that we see, in the science fiction movies that comes in and takes everybody out, is that going to be an influenza? Is it going to be, vector-borne? Is it going to be contagious?
Well, most of the experts I talked to, there were two that were at the top of their lists. And I think the caveat being no one expected Zika virus, right? So that was a completely unexpected emergence. That who would have thought a mosquito-borne thing that comes and then it's sexually transmitted, completely off the charts, and it causes birth defects. So predictions are not great generally, but the two that I heard the most about were certainly in novel forms of influenza, only because even a slight increase in mortality from an influenza virus would be a huge number of deaths because they're so good at spreading among us. And then the second one was antibiotic-resistant bacteria, which I think is a huge threat, especially to just the practice of medicine. It would change the face of medicine generally, where a scratch and a common injury can become a life-threatening problem suddenly if you have those bugs around.
And I mean, we saw just last week with the announcement of the microbe resistant to all antibiotics. People have a tendency to freak out, if you will, when they hear stuff. And journalists who sometimes do or don't have science backgrounds tend to not quite understand what they're writing about. How do you sort of live that balance, warning people what they should be cognizant of without actually terrifying them to death?
Right. So you kind of have to get in between being terrified and being, kind of denying it, right? Because I think, and this is, I had a chapter in my book that focused especially just on this, is how do we respond to these threats? And I think what I've seen is we either, freak out completely or we deny it. When the dengue broke out in Florida, people had parades in the street dressed up like dengue, dressed up like mosquitoes. There's a band called Dengue Night Fever. I mean, they just were, they're just completely denying that this thing was happening. Whereas then we have, one Ebola case and a teacher who goes to a conference in Dallas, 2 blocks from a hospital where that guy was treated, is quarantined for 2 weeks in Maine, which is, just out of control hysteria. And I think the reason is there is a common underlying thing to the response to that, which is that we tend to feel powerless in the face of infection. And I think as a society, we've sort of decided infectious disease is something that the experts have to deal with, the white-coated experts. So unless they can give us a drug or vaccine, we feel completely vulnerable. So it's the same way people respond to, say, the threat of death itself. You either, laugh it off or you freak out about it because you don't feel empowered to do anything. And I think that's what I was trying to get at in this book, is that there's a lot of ways in which we are empowered. We don't need to just wait for the drug or wait for the vaccine. There's things we can do as a society and as individuals too.
And yet when we tell people, even this year with Zika, about not leaving standing water, that just seems to go straight over people's heads. I mean, the concrete thing that the public can do, that the people who are not in white coats can do, seems to sort of not really work.
Yeah, and I think that goes back to let's wait until there's repellent we can put in that's magically going to take care of it, or you're just kind of veering between let's deny this is even happening, la 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 la, or or I'm going to freak out and not going to go anywhere there's mosquitoes, stay indoors all summer long.
So I wrote about the factory farm movement in the early 1980s from the animal welfare point of view. Do you think that now that we understand that factory farming is not just bad for the animals, but bad for the humans, do you think that there might be some way in to actually do something about some of these conditions?
Yeah, I think there is, and I think the current the Obama administration has made some moves. I mean, to start dealing with that, and internationally, there's more attention being paid, but it's already gotten, arguably to a crisis point. So we've already been terrible, we haven't safeguarded our antibiotics. We could have had these drugs around for a lot longer than we can. And I think the most the most popular response right now is to kind of throw more money at it to get the drug companies to make more antibiotics, because it's another case of market failure where I think it's something like 13 out of the 18 biggest drug companies in the world have dropped antibiotics out of their portfolios altogether because it's just, there's no money in it. And we as consumers, well, we as consumers, not all of you experts, but you know, we're not willing to pay more than a few $100s for really what's a life-saving drug, whereas tens of thousands will spend on, you know, a cancer drug that might extend life for a couple weeks or a month, which is on us too. But yeah, I think the you know, throwing more money at the market side of it is probably politically easier than actually reducing consumption. Although to me, reducing consumption is going to be the more sustainable solution in the end.
So what should sort of the next level up from the consumers be doing to prevent the next pandemic? Government, the WHO, policymakers?
I think one of the most promising develops that I saw over the course of just writing this book was these new efforts to kind of bring different disciplines together. The One Health movement, for example, where you're bringing veterinarians and wildlife biologists together with medical experts to look at the whole infectious disease process. So we're not just waiting until the outbreak occurs, which is arguably already too late, right? Because by the time that happens, we're seeing exponential growth of this pathogen, and our response at best is linear. So there's going to be a mismatch. We need to walk it back farther, and I think movements like One Health is starting to try to do that.
So you spent 6 years on this book. What went into this research, and how did you sleep at night without being terrified?
So I spent probably half the time reporting from you know, places where new diseases are emerging, and then about half the time looking at the history of pandemics, and then a bunch of years writing it and rewriting it and rewriting it again. So yeah, so that was the basic long process. But I don't feel frightened, I guess. One thing that lets me sleep at night, I should say, is this balance between, you know, you look at it from the pathogen's point of view. They want to, virulence is in their favor, right? Because then they get to replicate more, and that's what really mostly makes you sick. So that works for them, but they also need to transmit. That's the other constraint, right? They have to spread from one person to the other, and if they kill you too fast, you know, they're not going to be able to do that well. So, you know, that helps me. You know, I think about it. Yeah.
Well, I think we're gonna leave that there. Thank you very much.